This weekend, my mum said to me, "So are you planning on striking?" in reference to the GP industrial action which is currently being publicised in the media. I realised that if my own parents didn't understand what and why GPs were planning, that it was possible that our patients and staff might feel similarly. So,
I've been a doctor for 22 years. I went into the profession because I like helping people, and that hasn't changed. But it has got much harder to do this, and as a result, GPs are leaving in the hundreds and are seeking work overseas or in other careers. GP practices are closing across the country because of poor funding. We have to stand together and united to save general practice. Without this, there is a real risk of more practices in Somerset folding, putting impossible pressures upon those that remain.
So, what is this industrial action and how does it affect patients? Firstly, striking is not on the cards, but one of the significant pressures on general practice comes from the excessive administrative burden placed upon us when referring to specialist services. There was a time a few years ago when we could refer a patient to the hospital experts by writing a letter. These days, there are varying forms and pathways, investigations that must be done, written advice that often has to be requested before a patient is accepted by hospital services. This is often unnecessary and hugely time-consuming.
Secondly, our hospital colleagues are becoming increasingly reliant on GPs to prescribe specialist medications such as hormone replacement therapies and psychiatric drugs. This can actually be quite complex, risky and hugely time-consuming. Historically, this was the role of the specialist at the hospital and not the GP. This work is also unfunded and takes us away from the bread and butter of general practice. We're fully aware that our hospital colleagues are struggling as much as we are, and this certainly is not their fault, but it is eroding general practice day by day.
There has been mention of reducing the numbers of patients we consult with each day. This is not something we take lightly. We want to be there for our communities when you need us, but we need to make sure you are well cared for when you do seek our help. Your health is our absolute priority, and with 12-hour days, a common feature of GP's week, we are only human and are at risk of making errors if we push these boundaries.
All of us hope that this unified approach nationally will allow us to rebuild a general practice that will serve you and your family for the foreseeable future. Thank you for listening.